Hello and welcome. My name is Ben Gauthier, and I am the Events and Engagement Manager here at the University of Arizona Global Campus. I am the host of this session, Collaborative by Design, Fostering Interdisciplinary Team Learning for Scalable Technology Implementation in Health Education. By joining us today, you acknowledge that this session is being recorded and will be shared with TLC-related materials. Microphones will be muted for this presentation, but we encourage you to post questions and comments in the chat. Also, we have enabled live transcription. If you'd like to use it, click the Show Captions button at the bottom of your Zoom window. Now, I am pleased to introduce you to Dr. LaToya Green, Clinical Technology Product Manager from Novant Health.
Good afternoon, everyone. I'm Dr. LaToya Green, a Clinical Technical Product Manager at Novant Health. I lead digital transformation initiatives that bridge clinical operations and technology. My background spans healthcare and banking IT, project management, product development, and I'm passionate about using innovation to improve access, equity, and patient experience. I'll be sharing insights inspired by Peter Singe's work on learning organizations and how those principles can be applied to transform healthcare teams, culture, and outcomes. Today's presentation is titled Collaborative by Design, Fostering Interdisciplinary Team Learning for Scalable Technology Implementation in Health Education. Next slide, please. Our agenda for today: initially, we'll go over the overview of the case study, followed by the introduction of the research. Next, I'll present the theoretical framework and literature review, followed by the methods used and the results. We'll end with the discussion and the case study, as well as the conclusion. Next slide, please. So this project began with the challenging migration of multiple hospitals to a unified credentialing and billing platform, but it quickly became clear that success wasn't just about technology, it was about people. I applied Peter Singe's 5 disciplines of a learning organization to guide our interdisciplinary collaboration. What emerged was a resilient, feedback-driven team that embraced change, challenged assumptions, and built shared vision. And today I'll walk you through how those disciplines showed up in real time and what they mean for health education and leadership development. Next slide, please. So the purpose of my research was to examine how learning organization principles support scalable technology implementation in healthcare. At the current hospital system that I work for, our legacy systems created fragmented workflows, duplicated efforts, lots of resistance to change, and we needed more than a technical fix. We needed cultural transformation. So what we did is we asked 3 questions. How do learning organization principles support scalable tech implementation? And what outcomes emerge when teams embrace shared vision and systems thinking? And also, how can this inform future training and education models in healthcare? Let's explore how Singe's disciplines manifest in real-time migration. Next slide, please. So the theoretical framework, what we did was we anchored our approach in Singe's 5 disciplines: personal mastery, mental models, shared vision, team learning, and systems thinking. So the personal mastery is all about helping individuals gain clarity and confidence. And then, of course, mental models basically allowed us to surface and challenge surfacing assumptions. For the shared vision, basically it aligned diverse stakeholders around a common goal. And then with the team learning, it aided in fostering cross-functional collaboration. And then, of course, systems thinking was seeing the whole picture and interdependencies. And these weren't just theoretical, they became the heartbeat of our migration strategy. Next slide, please. So for the literature review, I drew from a rich body of work. Peter Singe, the 5th discipline, the art and practice of learning organization, emphasized feedback and shared vision as drivers of change. And then Stephen Covey's The 7 Habits of Highly Effective People reminded us that trust and clarity fuel performance. Tom Rath's Strength Finders is a strength-based leadership book that helped us to build confidence. And then I referenced Edmondson and Harvey's Cross-Boundary Team for Innovation. This helped me to carve out how psychological safety enables innovation. Together, these insights shaped how we built and supported our project team. Next slide, please. So for the methods, we used a narrative case study approach to capture lived experience. Our setting was a multi-hospital system undergoing EMR and ERP migrations, as well as multiple acquisitions and mergers. Participants included internal teams, external vendors, and consultants from various consulting firms. We analyzed project documentation, training materials, and feedback cycles to understand how learning disciplines emerged and evolved. Next slide, please. So here's what we saw. We saw that personal mastery led to role clarity and confidence. People knew their lane and felt empowered. And then with the mental models were challenged. And so resistance eventually faded as assumptions were surfaced. The shared vision unified departments and vendors, and everyone knew the why, and we began with the end in mind. Team learning accelerated problem solving. Cross-functional teams became our superpower, and then systems thinking helped us to prioritize. We saw how every decision rippled across the organization. Next slide, please. The visual framework. Each discipline contributed to adoption, sustainability, and unified platform success. This diagram shows how each discipline contributed to our success. At the center is our goal, a successful credentialing migration that unified, adopted, and was also sustainable. And around it are the 5 disciplines, each one reinforcing the other. It wasn't a checklist for us. It was more like a living system of learning and adaptation. Next slide, please. So what does all of this actually mean for health education and the future of healthcare transformation? When this project started, it looked simple on paper, migrate an outdated credentialing platform to a new cloud-based system. But very quickly, we realized it wasn't a technical upgrade, it was an organizational awakening. In the beginning, only the business office and one project manager were at the table. There was no representation from any of the integrations team, no IT architecture input. We had limited clinical engagement, and everyone assumed their part was small, just data migration or workflow mapping. But as the project unfolded, we began to hit friction. Data didn't match, workflows conflicted, timelines slipped, and teams started blaming one another instead of communicating with one another. And that's when I realized this wasn't a technology problem, it was a team learning problem. We were trying to build a system across silos that had never actually learned how to work together. So halfway through, maybe even later than we should have, we brought in a full ecosystem. So we brought in information technology integration teams, we brought in the analytics team, the credentialing business analysts, human resources, and other vendor partners. And suddenly there were 5 different teams, all speaking different languages and all with their own priorities. Early meetings were chaotic. It felt like 5 separate projects colliding in real time. But over time, as we began to apply Sinja's disciplines, something started to shift. Psychological safety became the foundation. Once people realized it was okay to say, I don't understand this integration point, or maybe we can't meet that deadline without help, the tone changed completely. Conversations got real, and instead of pointing fingers, people were able to start connecting dots. So shared vision came next, and not from a leadership deck, but from honest dialogue. Once every team understood why we were doing this, a unified source of truth for a provider credentialing system that would ultimately improve patient safety and experience. We stopped working in isolation, and that clarity reduced resistance and built resilience. Then for the team learning started to emerge through constant reflection. We started hosting after action reviews. We had many informal learning huddles and joint planning sessions. People who had never collaborated before began to finish each other's sentences. And then through the systems thinking, we saw how every decision, every interface, every workflow, every tweak had ripple effects across the organization. We stopped thinking in tasks and started thinking in relationships. I think for us, the turning point came when one of our RT leads said, "This isn't an implementation anymore, this is transformation." And he was right. We didn't just migrate data, we migrated mindsets. So these lessons have direct implications for health education and workforce development. Whether we're onboarding new clinicians, designing interprofessional education, or leading transformation projects, the same principles apply. Psychological safety isn't optional, it's foundational. Shared vision reduces resistance and builds resilience. And team learning isn't just collaboration, it's transformation. If we can teach future leaders to think this way, to engage people early, to to align goals across silos, and then to see systems rather than parts, then we're not just training employees, we're cultivating system thinkers who can lead in complex adaptive environments. Next slide, please. So St. framework gave us more than a language. It gave us a way to survive complexity. By embedding learning disciplines into our migration, we built a model that's scalable across any healthcare transformation, whether it's credentialing, EMR modernization, telehealth, or AI-driven decision support. The biggest barriers weren't the tools, they were the misaligned workflows and the lack of early engagement. Technology fails when it's implemented to people instead of with them. What changed our outcome was bringing those clinical and technical voices together, creating shared ownership before the go live, not after. We also learned that equity and innovation must grow together. Cloud technology can close gaps in access and efficiency, but only if we design intentionally for inclusion. Like if broadband language access or digital literacy aren't considered, even the most advanced tools can widen disparities instead of closing them. So looking ahead, the future of healthcare transformation will be shaped by three things, which is AI-driven decision support, integrative health, and patient-centered digital ecosystems. But the real disruptor isn't the technology, it's how well we adapt culture and governance and use it responsibly. And that's the real takeaway here. Learning isn't just a project phase, it's the strategy. Because when teams learn together, systems evolve together, and that's how we build a healthcare future that's innovative, equitable, and sustainable. Next slide, please. So that wraps up my conclusion. I'm sorry, that wraps up my presentation. I'd love to hear your thoughts. If anyone wants to talk about how they foster team learning in their organization or what barriers to shared vision have you encountered, I'd be open to hearing about it and answering any additional questions.
You're welcome to unmute at this time.
I think we're good on questions.
Okay. In that case, thank you so much, Dr. Green, and thank you to the audience for your participation in today's session. Please use the survey linked in the chat to nominate TLC presentations for conference awards and share your feedback on this presentation.
Thank you all.
Appreciate it.